Now, again, coming to the malaria, the vector is female Anopheles mosquito. The pathognomic keynote point is the malarial paroxysm. It coincides with release of merocytes from ruptured RBCs. Very, very, very important. If you go through your textbooks, you can have an idea about trophocytes, merocytes, pre-erythrocytic schizogony. There are many stages, but here the malarial paroxysm, the fever paroxysm coincides with release of merocytes from ruptured RBCs. So this point you have to keep in mind. And important clinical features, Plasmodium falciparum. It's called furious malaria. And I told there will be cerebral malaria. There will be cerebral symptoms, CNS symptoms. And there is a term called algid malaria. What is meant by algid? Whenever you hear the word algid, you have to remember there will be hemodynamic disorders such as shock, blood related. So please remember, cerebral malaria is CNS related. Algid malaria is nothing but it is characterized by hemodynamic disorders, mainly shock and hypovolemic shock, generally associated with metabolic changes and hypothermia. You know when the patient is in shock, right? So this point you have to remember. And there is a term called black water fever. What is black water fever? It is nothing but complication of malaria, because in these patients, there will be dark color of the urine. They will expel dark color of the, they will expel urine which is dark in color due to hemolysis. So that is why urine appears dark. Now I have a question here. I want all of you to reply. What is black death? Which disease is called as black death? Can anyone type? Black death is which disease? Parvati, some people have replied it's plague. Very good. So don't get confused between black death. Somebody has replied it's Mediterranean fever. More than Mediterranean fever, classically in all the textbooks, if you see, black death is classically, it's a name given for plague. And black water fever is malaria. Okay. So you have to remember here. And some of the terms such as cerebral malaria, algid malaria, you have to remember. Now, lab criteria for severe malaria. This is very important, the very unique investigation, because I'm not discussing about the common investigations in malaria. You all are qualified doctors. You might be having some idea, but exam point of view, what is important here is parasite density should be more than 5%. That is very important. This is an important lab criteria to diagnose malaria. Parasite density more than 5% and severe anemia. When will you call it as severe anemia? When the hemoglobin is less than 7 gram per deciliter. Okay, so please remember these two values: parasite density more than 5%, and severe anemia where hemoglobin is less than 7 gram per deciliter. That is very important, or 70 gram per liter. That units are interchanged here. And if there is disseminated intravascular coagulation, hemoglobinuria, metabolic acidosis, renal failure, all these you know because you have written a lot in UG exams, but please remember the cutoff values of parasitic density more than 5%, anemia less than 7 gram per, HB gram percentage less than 7. And again, one more important thing, the classical or gold standard diagnosis. You know what is gold standard, right? See, there are many investigations, but to tell that it is exclusively malaria, you should always do light microscopy of the blood, thin and thick smears. Very, very important. Classically, both thick and thin smears are done to diagnose malaria. This is the gold standard diagnosis. And along with that, you can do rapid antigen testing, rapid diagnostic test.